29 million Americans have diabetes. In this country, 1 in 4 are unaware of the disease.
Economic costs to the country are over $300 billion a year on diabetes. That's 1 out of every 7 healthcare dollars. Our current healthcare system is not well designed to take care of the medical and social issues of patients.
It's important to address those social needs for diabetes care because unless patients really have a holistic approach to their care, it's quite challenging to manage diabetes just with medication and health services alone.
For as long as we have been measuring and following disparities in diabetes and other chronic diseases, what we've known is that racial and ethnic minorities and other marginalized populations have fared worse. We've made some progress, but we need to make significantly better and faster progress in this. We have to invest and think about what's happening when people are not in our medical system.
That's why the Merck Foundation created the Bridging the Gap program so that we can share learnings and advance as quickly as possible for solutions that will be helpful across the country.
Bridging the Gap is a 5-year initiative focused on addressing medical and social needs for patients with diabetes, and it's really looking for ways for healthcare organizations, community-based organizations, and other stakeholders to work together to improve outcomes for patients.
We have 8 innovative grantees designing and implementing state-of-the-art care in terms of the way that they deliver care in the healthcare system and the way they specifically address the medical and social issues of patients. In addition, we are working with the grantees along with their payers to find ways that these types of interventions can be financially sustainable.
When you have patients who continue to seek care in the hospital because they're quite sick, I think these organizations recognize that there's something else going on outside the walls of the healthcare system that they need to be ready to respond to. And Bridging the Gap really provides that opportunity for response, intervention, creativity, and collaboration with a healthcare team, but also with important community partners who have great solutions to bring to the table.
It's bridging 2 different gaps. The first gap is the health equity gap between those who have diabetes and are doing well and those who have diabetes and are not doing well. Bridging the Gap also refers to bridging that space between healthcare institutions and non-healthcare institutions to really try and maximize the health of community.
The Merck Foundation has named University of Chicago as the National Program Office. We conduct a cross-site evaluation, we help with dissemination activities, and we also help to foster a learning collaborative across grantees.
The United States is a very diverse country. We have diverse population, we have diverse settings, ranging from cities to very rural areas. And our 8 grantees in Bridging the Gap span that spectrum of diversity.
We're fortunate to work with urban sites, rural sites, and also a frontier health system. We have the advantage of learning from federally qualified health centers, from integrated delivery systems, from critical access hospitals, and from health departments and their clinic community partners. We also have one site which represents a community health collaborative that's composed of both healthcare organizations and community-based organizations.
The advantage of having lots of different people in lots of different sites and situations is that we can have a bigger bird's eye view as to what's happening nationally and not only what's happening at one specific site.
Bridging the Gap is a 5-year initiative because successfully addressing the medical and social factors that impact patients is a difficult job. In the first year, our grantees are planning what the interventions will be. In years 2, 3, 4, and 5, each of the grantees is implementing the intervention. Oftentimes, they'll have to adapt too, because they'll try something. Some things will work, some things will need to be adjusted, and this is an ongoing process.
We're learning that we can't be prescriptive going forward about the kinds of strategies that a healthcare organization should or should not use. It's really going to be a reflection of the geographic context in which a site is placed, the type of healthcare organization that they represent, the type of community partners available to work with them, and the needs of their specific patient population.
There's great interest across the country from a variety of different groups. We're all looking for ways to improve diabetes outcomes and address these important medical and social factors. The ultimate goal is to have interventions that can be part of just the bread and butter of American healthcare.
And so what we're trying to do with Bridging the Gap is to identify and showcase the possibility of what can happen, to bring to light the successes of what can be possible. But what we really need is larger payment reform in order to be able to make these things sustainable. The reason that I have so much hope is that for the first time, the healthcare system is recognizing that we can't do it alone. And so we are opening our doors and our hearts to others that are not in healthcare and working collaboratively on solutions. And I think that's new and a degree of sincerity that I've not seen historically, and that gives me great hope.